After finishing our first aid lesson, we move on to our next topic, diabetes. In a healthy person, insulin works like a key that opens the door to the cell, allowing blood sugar to enter from the bloodstream. But people with type 1 diabetes don't have the insulin key, so the blood sugar can't enter the cell and start to build up in the bloodstream. People with type 2 diabetes, they have the insulin key, but it doesn't work well. It doesn't fit the rock properly, so the door to the cell doesn't open. Type 1 diabetes usually happens in children and teenagers. It starts suddenly when they are young. But type 2 diabetes usually happens in adults. It comes slowly and many people don't notice it at first. It is often caused by unhealthy eating and being overweight. It happens slowly as people get older. In this case, the key is insulin, a very important hormone in our body, and the rock is the many cells in our body. So when the sugar in our blood can't enter the cells because there is no insulin, or the insulin doesn't work properly, the sugar stays in the blood and build up. This condition is what we call diabetes. The clearest way to check for diabetes is by measuring blood sugar level. Do you remember when we measured our blood sugar level together? The normal range depends on how long it's been since you last ate. If you are fasting, no food for at least 8 hours, a normal blood sugar level is below 100 mg per deciliter. And 1 hour after eating, it should be below 180 mg per deciliter. 2 or 3 hours after eating, it should be below 140 mg deciliter. If your blood sugar level is higher than these normal ranges, you may need to suspect diabetes. If your fasting blood sugar is 126 or higher, or if it is 200 or higher, 3 hours after eating, you may be diagnosed with diabetes. Measuring blood sugar is the best way to check. But if you don't have the tool to do that, you can reflect on how you have been feeling lately. That's because there are early symptoms of diabetes. There are 3 high signs. We call them the 3 high of the diabetes: peeing a lot, frequent urination, eating a lot, increased hunger, drinking a lot, excessive thirsty. Other signs include sudden weight loss, feeling tired all the time, and itchy skin or skin problem. The reason why diabetes is so scary is because it causes inflammation starting from the small blood vessel in the body, and then cholesterol stick to the inflammation, gradually blocking the blood vessel. About 7 to 8 years after diabetes begins, blood vessels around the nerve start to have problems. Then sensation become weak, and if the motor nerve are affected, foot deformities can occur. Around 10 years later, blood vessels around the eyes can be damaged, causing blurry vision. Also, wounds on the feet don't heal well, and if chronic wounds form, in serious case the foot may need to be amputated. After 12 years, the blood vessels near the kidneys are affected. When the kidneys are damaged, they can't filter the blood properly, and you may need to get dialysis with a machine. If the kidneys don't work, the body also can't get rid of excess fluid, which causes swelling in the hand and feet. To prevent diabetes, do you remember the 3 tips I shared? First, weight loss. This is the most important. Even if you lose just 5 to 7% of your body weight, it can stop diabetes from starting. Second, a healthy diet. Eat colorful vegetables and fruit. Choose food that you can see and recognize the ingredient. And try to reduce the 3 white things in your diet: white flour, sugar, and salt. Also, the order in which you eat is important. If you eat vegetable first, then protein and carbohydrate last, you can prevent blood sugar spike. A blood sugar spike is when your blood sugar rises quickly and drops suddenly, making you feel tired and hungry even after eating. People with diabetes often struggling with this. But if you eat vegetable first and carbohydrate last, you can help prevent this spike. Third one is regular exercise. When we hear about exercise to lower blood sugar, it sounds like something big and very difficult, right? But actually, they are very simple and you can even do them right here, right now. Do you remember the exercise I showed you? Khadija and Mariam followed along with us, right? And our chief of the Women's Center, Madame Kados Rachida. I really hope she continues doing these simple exercises for 1 hour every day, so her blood vessels can become healthy again quickly. During the last 2 sessions, we had sex education classes. Giving sex education faced a lot of opposition and we had to be very careful. But whether it was during our field visit to the earthquake-affected region of Iminogalis or during our regular health classes, many Moroccan women expressed their desire to learn about sexual and reproductive health. Finally, is there anything you think we could improve for next time?
إن شاء الله جينا عندكم المرة الجاية. واش كتظنوا شي حاجة باغيين تعرفوها نزيدوها حنا في الحصص ديالنا ولا شي حاجة نقدروا ما درناهاش تمنيتو كون درنا
تبغيو تعرفوا عليها أكثر من غير هادشي
باش حتى حنا نحسنوا من راسنا ونحسنوا بداكشي اللي كنقدموا لكم.
شي بحال بغينا نستافدوا من بحال الوالده ديال المراه بحال كيف كلشي بحال الوالده تعطونا النصائح عليها.
For example, for the menstruation cycle and this kind of topics, they really want to know. That's also, yeah.
It's our class topic. Wow. Oh, they want to.
Especially that they already got pregnant or they want to get pregnant, so they want to know the best ways to protect their babies. And
It turned out the idea that Moroccan people would be too shy or reluctant to learn about sex education was actually a judgment made by foreigners like us. Moroccan women are curious about their menstrual cycle, period pain, childbirth, and contraception. So among all the health lessons I have prepared, I found the sex education lesson to be the most fun and meaningful to me. Why? Because in Korea, people said this kind of lesson was unnecessary and dangerous, but here in Morocco, I realized it was actually one of the most needed. Now, shall we review the menstrual cycle lesson we learned together? Do you remember the menstrual cycle bracelet we made together? Everyone looked so beautiful wearing it. First, do you remember the average length between the first day of one period and the first day of the next period? Yes, it was 28 days, right? Then how many days before the next period does ovulation happen? Yes, 14 days before. Now, do you remember what the period was called from 5 days before ovulation to 2 days after ovulation? Yes, the fertile window. This is the time when the chance of pregnancy is the highest. If you remember just this one principle, you can easily find your ovulation day and fertile window. And during that time, you can be extra careful if you want to avoid pregnancy. And we also learned 4 ways to relieve period pain. First, you can place a warm pack on your lower back or lower belly. Second, you can take pain medicine. We learned that there are 2 types of painkillers, right? One is antipyretic painkillers, which relieve simple pain and fever. The other is anti-inflammatory painkillers, which help with both pain and inflammation. For period pain, anti-inflammatory painkillers are usually more effective because they reduce inflammation as well. However, because these medicines are strong, taking too many in one day can be harmful. In Korea, people usually take medicine that contain ibuprofen, but in Morocco, pharmacies often give painkillers that contain ketoprofen or mefenamic acid. Both of these are stronger than ibuprofen, which means they are more effective but also may have more side effects. For ketoprofen, it's recommended to take only 1 pill per day. And if the pain is very strong, you may take up to 2 pills. But they should be taken at least 12 hours apart. Third, we recommend drinking warm tea. Teas that are good for period pain include ginger tea and chamomile tea. Fourth, you can do some light stretching or yoga. Do you remember the game we played called Secure the Mat? It was so much fun, wasn't it? Once again, congratulations to Moashin, the champion of our game. Okay. Do you remember the documentary we watched together at the end of that day, called Period? This documentary showed the story of a woman in a rural village called Kathikkerala in Hapur, India, who manufacture and sell sanitary pads themselves. And the unfair truth about menstruation that they face and how they overcome them. In this village, culture and religious taboo about menstruation made it hard for women to manage their menstrual hygiene properly. In fact, 65% of female students in India said they don't go to school during their period. The main reason were difficulty concentrating in class, menstrual pain, fear of blood staining their clothes, or fear that their cloth pad might fall out. In our class, we had a discussion about how menstrual hygiene is related to women's empowerment. We talked about why this pad project is necessary, whether it is a project only for women, and how women's empowerment through this project can lead to not only better women's health, but also positive change in their families, their communities, and even their country and the world. Through this discussion, we thought deeply about how solving menstrual hygiene issue together as a global community. In our final class, we talk about birth control pills and childbirth. To be honest, at first, I wasn't planning to talk about birth control pills in Morocco. But during our menstrual cycle bracelet activity, many of you asked the question about birth control pill, and I was so happy to see your curiosity that I decided to include it in the class. To explain how birth control pill work, we also need to explain the 4 hormones involved in the menstrual cycle. Of course, just understanding estrogen and progesterone, the 2 main hormones, is usually enough. But I thought you are so smart that you'd be able to understand FSH and LH as well. Still, I was worried that the content might be too difficult, but thankfully, a Moroccan medical student I met by chance at the printer shop offered to join our class. Together with the medical student, we work hard to explain how all 4 hormones change during the menstrual cycle. And you all understood it, right? But let me review it one more time. When the FSH hormone level rises in a woman's body, a follicle, like a small pouch holding an egg, begins to grow. As the follicle grows, it produces estrogen. And the rising estrogen level causes a spike in LH hormone. LH then helps the follicle release the egg. This is what we call ovulation. After ovulation, the follicle turns yellow and we call it the corpus luteum. The corpus luteum releases estrogen and especially progesterone, which prepare the uterus to support a possible pregnancy. Progesterone helps build a thick uterine lining and create a lot of blood vessels, a soft and safe home for a fertilized egg. But if fertilization doesn't happen, the corpus luteum turns white and stops producing estrogen progesterone. Then the body realizes there is no pregnancy and it sheds the uterine lining and blood vessels. This is what we call a period. And this is exactly how birth control pills work. They increase estrogen and progesterone levels in the body on purpose. So the body is tricked into thinking it is already pregnant. If the body thinks it's pregnant, it doesn't release an egg, no ovulation. And if there is no egg, there can be no pregnancy and also no period. And we also explained the different types of birth control pills and how to take them right. The second and third generation pills contain progestin hormone that are similar to male hormone, so they can cause side effects like acne, excess body hair, and weight gain. On the other hand, fourth generation pills don't cause those side effects, but we said they had a higher risk of a blood clot. That's why if you have a heart or blood vessel disease, or if you smoke, it's better not to take birth control pills. Birth control pills are usually based on the average 28-day menstrual cycle, so we explained that you take one pill a day for 21 days, then take a 7-day break and then repeat 21 days on 7 days off. We also mentioned that during the first 7 days of taking the pill for the first time, the pill doesn't fully protect you yet. So you need to use additional protection like condom during that time. Not all birth control pills follow the 21 and 7 schedule, but all types must be taken once a day at the same time, without skipping to be effective. And do you remember that in our final class we learned about childbirth? We said that babies cannot eat or breathe like us, so they rely on the placenta and umbilical cord. The placenta is connected to the mother's blood vessel, and it delivers nutrition and oxygen to the baby, and also helps remove waste product from the baby's body. The umbilical cord connects the baby to the placenta. It runs from the baby's belly button to the baby's heart. Inside the umbilical cord, there are 2 arteries and 1 vein. After that, we learn about how the baby grows inside the womb. Do you remember the different name we used to describe the baby? From week 1 to 8, we call it an embryo. From week 9 to 40, we call it a fetus. The reason we studied the difference between embryo and fetus was to help you understand embryonic stem cells. Embryonic stem cells are an important technology used to treat incurable disease like leukemia and ALS, Lou Gehrig's disease. However, there are ethical concerns because the stem cell come from embryo. We had a heated discussion about whether or not an embryonic cell should be recognized as a life. This kind of debate is happening all over the world, and the fact that we too are discussing this issue show that we are part of one world, sharing and thinking together about global questions.